My name is Christopher Richards. I'm a pulmonary critical care fellow here at the Harvard Combined Program and a former resident of the Beth Israel Deaconess Medical Center.
And I'm Christopher Smith. I'm the Internal Medicine Residency Program Director here at Beth Israel Deaconess Medical Center and Harvard Medical School.
My name is Denise Duper, and I'm an Associate Editor for the Journal of Graduate Medical Education. Today we're going to talk about a very interesting paper, Fourth Year Medical School Course Load and Success as a Medical Intern. I'd like to thank the authors for coming and speaking with me today about this.
Thank you for having us, Denise.
So what made you decide to ask this question?
We designed this study as part of our program's Clinician Educator track, which is a part of the residency program that trains residents in teaching skills, educational skills, and kind of develops us for a career in medical education. And Dr. Smith and I came up with this project to see if we could at all contribute to the conversation that was going on at the time about how medical schools were restructuring their undergraduate programs. Then as now, a number of schools have been debating the value of the fourth year of medical school. So there's a number of schools that have switched the curriculums to three-year programs. There are schools which are moving to extended programs which allow for personalized research time. And there's schools which have not adjusted their programs and are keeping to a traditional four-year model. So we wanted to see if using our residents as a baseline, could we learn more about what is actually happening in the fourth year and to what extent course selection is influencing their performance when they start residency.
So what would you say were the most important findings from your paper?
So one of the main and interesting findings was that was surprising to us was the number of intensive courses or the makeup of the fourth years that our interns were actually experiencing. So we saw that there was a maximum number of 4 intensive courses in our intern class, and a median of 2 with a minimum of 0. So there was a number of interns who had taken no what we deemed intensive coursework in their fourth year. The other major finding of the study was that intensive coursework led to a significant improvement in one's scores across the different JGME clinical milestones. In addition to that, we also saw a negative influence of non-intensive coursework on those same milestones.
So that's a very important finding, and I think especially in light of the fact that schools are looking to change what the fourth year is and whether a fourth year is necessary. What do you think this means, or what are the implications for program directors?
You know, I think less about the implications of program directors in terms of whether I would take an applicant or not into my program, and more in how I actually advise fourth-year medical students. I think these findings really support the concept that the fourth year of medical school is important. Just like anything that we're trying to learn, any knowledge or skill, there's a development that happens naturally. And if you move away from that and practicing those skills or learning those skills, there'll be a natural decline. So it would not be surprising to expect for a fourth-year medical student who doesn't take some rigorous courses in the second half of their fourth year that they may have a decline in their knowledge and skill set before they enter their intern year. With this in mind, I advise medical students to consider taking 1 or 2 rigorous courses in the second half of their fourth year to better prepare themselves to be an intern as they transition from being a medical student to an intern.
And so for the medical students, then, it sounds like as an advisor, it would be very important that they consider this as they're looking to go into internal medicine. Do you have any thoughts on what students experience in their intern year? Is there differences in the amount of stress they perceive, whether or not they've been trained or had this additional fourth-year rigorous clinical experience?
You know, I think the fourth year of medical school is a wonderful opportunity to explore new areas within medicine, to conduct research, or advance other academic skills that may help you in your future career. So I wouldn't want students to think that this study implies they need to pack their entire fourth year with rigorous rotations. I do, however, think that it would be important to incorporate 1 or 2 more rigorous rotations in the second half of the year to help them with their development.
With all the emphasis on resident burnout and fatigue, it also makes me wonder whether or not if students were better prepared, they would be less at risk for those very concerning issues that we are now identifying more frequently.
You know, it's hard to understand exactly the impact from this study from one intern to another in relation to the course load they took. It's also possible by the second half of the intern year that their skill level had caught up. But as you're alluding to, what you don't know is the impact on one's sense of self-efficacy, one's sense of their ability to succeed, and as you allude to, how this might impact one's burnout through intern year. If they're more prepared coming into the intern year, will they actually succeed and be more likely to thrive during that year as well?
You know, and interns have different goals over the course of their careers, right? Some people are interested in a career that ultimately winds up in research. Others are interested in careers that wind up in education, private practice. I mean, everyone is going to go to a different endpoint. So people are still going to design a fourth year that informs those personal choices. I think what we would advise is that students keep in mind what they want to be doing in medicine and make sure that they use the fourth year as a time to take coursework that is going to get them to that goal. And the more courses they can take, I think it's probably the better.
I guess one of the other questions we might ask is whether the effect size you found would be significant in terms of their educational performance.
I think it was important in the study that there was a dose-dependent response that did happen both in a positive and negative manner. So the more intensive courses you took, the more likely you were to succeed or have more positive evaluations as an intern. And the more less intensive courses you took, the less likely you were to have the positive correlation with your performance as an intern year, which I think helps support the findings within this study.
Well, I want to thank you both for taking the time to meet today to discuss the very interesting study that will be upcoming in our February issue of the journal.
Thank you, Denise. It's a pleasure to be with you.
Thank you very much for letting us speak with you today.